Hello, I'm Adriana, and today I will be presenting on Patient X. Patient X is a 49-year-old Caucasian female who works at a high school as a Spanish teacher. When I asked the patient what her chief complaint was, she said that she had had difficulty breathing and had felt a tightness in her chest. The patient also said that she had found an abnormal-looking mole on her right tricep area. When I took the patient's vitals, I found that the patient had a temperature of 98.7 degrees Fahrenheit, had a blood pressure of 118/70, had a heart rate of 88 beats per minute, and a respiratory rate of 14 breaths per minute. The patient has had asthma ever since she was born. Patient X's asthma is triggered by her allergies. The patient's allergies include pollen and animal fur. The symptoms that the patient has are watery eyes, an itchy throat, and a tightness in her chest. The allergies make it difficult for the patient to go outside and enjoy daily activities. The patient also struggles going to sleep and staying asleep at night. The patient says that these symptoms typically occur the whole day when they do happen. The allergies typically happen during the summer and spring months, the patient said. The patient uses an inhaler whenever she cannot breathe due to her asthma and takes one Zyrtec tablet per day if necessary. The patient has also noticed an abnormal-looking mole on her right tricep area. The mole has changed shape from what it originally looked like, and it also changed size and color. The mole does not look like it originally did, the patient said. The patient does not know when she first had gotten this mole and does not know exactly when the mole started changing shape and size and color. The patient is worried because she has had a lot of sun damage in the past and because she has had cancerous moles removed before. The patient has not noticed any different symptoms and claims that it does not interfere with her daily activities. The patient also added that she has not done anything to treat this mole. The patient has a health history of depression, IBS, shingles, chickenpox, appendicitis, dysplastic nevi, and vertigo. Patient X is up to date on all her immunizations and denies any medicinal allergies. The patient has been hospitalized once before for her appendicitis, but denies any further hospitalizations. The patient claims to take 40 milligrams of simvastatin once a day before bed, 40 milligrams of fluoxetine once a day in the morning, 50 milligrams of bupropion once before bed, and 20 milligrams of atrovent taken as needed. The patient also claims not to smoke or drink. The patient quit smoking at the age of 34 and does not drink because of her medication. The patient also claims to sleep 9.5 hours a night on average and exercise 3 to 5 times a week for an hour each time. Furthermore, the patient claims to eat balanced and healthy meals and tries to include all the food groups. The patient claims not to drink any soda, but she does drink about 2 cups of coffee a day. The patient is married and has 2 children and lives in a safe environment. The patient teaches at a private high school at the AP and 4 honors level for Spanish. The patient claims to have a lot of stressors, such as her children and work, but also claims to put a lot of stress on herself that is unneeded. The patient is a practicing Catholic and has earned her master's degree. The patient also claims to go to the OBGYN once a year, as well as having a routine physical checkup a couple times a year as well. As for family history, the patient says that her father has had a heart attack, high blood pressure, type 2 diabetes, and high cholesterol. The patient's mother has fibromyalgia, high blood pressure, and high cholesterol. The patient claims not to know any medical data on her paternal and maternal grandparents. The first focused assessment I did on the patient was the respiratory exam because of the tightness she felt in her chest and her lack of ability to breathe. I first asked the patient a few questions, to which the patient fully answered. The patient told me that she only has shortness of breath when her allergies and asthma kick in. The patient also denies any history of pneumonia and bronchitis and says that she only coughs or has only coughs because of her asthma. She claims that this cough is a dry cough and does not release any sputum. I also asked if she had had frequent upper respiratory infections, and the patient also declines this. The patient also says that she has pain and wheezing whenever her asthma kicks in. The last question I asked the patient was if she did self-exams on her breast monthly. She said that she did, but she denied finding any lumps, discharge, or pain. The patient also said that she has had mammograms done before, but has had no abnormal findings. I then did a respiratory exam on the patient, and when I did the inspection portion of it, I found that the patient seemed to be in a lot of distress because of her lack of breath. I then moved to the palpation portion, and when I did this, I did not find any abnormal findings. When I auscultated the patient for the respiratory part of the examination, I found that I could find wheezing sounds posteriorly. There were no other abnormal findings during this examination. I then did an integumentary examination on the patient to inspect the abnormal looking mole that she had on her right tricep region. I asked a few questions before, to which the patient fully answered. The patient exclaimed that she has not had any new symptoms of dryness, moisture, or flakiness. The patient also said that she has not noticed any new hair distributions or any abnormalities in her nails. The only skin abnormality and change that the patient has noticed was the abnormal looking mole on her right tricep area. I then asked the patient if she had spent long times of period in the sun, to which the patient said that when she was younger she used to stay out in the sun for a long time and not wear sunscreen. As of now, though, she does wear sunscreen every single day and started to apply sunscreen in her early 20s. I then conducted the integumentary assessment on the patient, and I found no abnormalities in her hair distribution, and I found no flakiness of the scalp. The only abnormality I found in the patient was the abnormal looking mole on the patient's right tricep area. The mole had a rigid outer portion of it and had a pinkish tint to it. If I were to assess pertinent systems on this patient, I would conduct the cranial nerve assessment and the abdominal assessment. I would do the cranial nerve assessment on this patient since the patient presents signs of vertigo. The patient complains that she will get vertigo about twice a month and that it interferes with her daily activities. To this day, she has not been formally diagnosed and does not have any treatment options. According to the British Medical Journal, a cranial nerve assessment would be appropriate to test vertigo because during this examination we can test for the cranial nerves 2, 3, 4, 5, 6, 7, and 8, all which help assess vertigo. The British Medical Journal also states that although the entire cranial nerve assessment is important in testing vertigo, these are the most pertinent systems to test. I would also do an abdominal assessment on the patient to test for her IBS symptoms. The patient explains that she has these recurring IBS symptoms, thus I think it is important to assess it. I would do an abdominal assessment because according to the BMJ, the symptoms that IBS shows are abdominal bloating, distension, tension, and hardness. All of these could be assessed during the abdominal assessment and could help diagnose to see if the patient actually did have IBS or not. Once again, thank you for listening to my presentation on patient X.